everyone, welcome to Top Talk today. And let me introduce you today's host, Professor Xin-Hao Ai. She is an MD and is the Deputy Director of Oncology Department in Shanghai Chest Hospital, Jiao Tong University. And she has rich experiments in chest oncology. And she has some queries about clinical treatment and researches of thoracic cancer today.
Good afternoon, everyone. I'm Xin-Hao Ai from Shanghai Chest Hospital. Today our top talk will discuss about the promising results of CheckMate 743 and sharing clinical experience and look into the future. So it's my great honor to introduce two famous specialists in thoracic oncology. One is Professor Paul Bass. Professor Paul Bass.
I'm Paul Bass. It's a great honor to be invited for this interview, and I've indeed been the main author for the researcher for the 743 study. I'm the head of the Department of Thoracic Oncology in the Netherlands Cancer Institute.
Thank you, Professor Bass. And another professor is Professor Shun Lu from Shanghai Chest Hospital. He is the Director of Oncology Department in Shanghai Chest Hospital. So we have prepared several questions for these famous specialists. So we go to the first question. This question is for Professor Paul Bass. So as a rare thoracic cancer, what is the current international standard of care for malignant pleural mesothelioma? What progress has been made in research during the past few years? Please, Professor Paul Bass.
Yes, thank you. So I think it's an important question because the field of mesothelioma treatment has been very difficult. In the 90s, we have started with all kinds of phase 2 studies to find any kind of chemotherapy that would be active. And it was only in 2003 that the study by Vogelsang identified that the combination of cisplatin with pemetrexed, an antifolate drug, would have a good result for the patients with this disease. That has been more or less the standard until today. There have been some studies that try to improve it, let's say maintenance treatment, but that was negative. So continuing with pemetrexed, as we do sometimes in lung cancer, was not active. The French group has tried to improve the survival by adding bevacizumab, and there was some advantage, but the hazard ratio was not very high, and the patients were also selected for those that could have bevacizumab. So it never went to become a new standard, and it's only now after 16, 17 years that immuno-oncology drugs have been tested versus chemotherapy.
Okay, thanks, Professor Bass. And because our audience is almost in China, so the question I asked for Professor Lu Shen will ask in Chinese. So we go to the second question. 陆教授，那么我们第二个问题是，您认为中国胸膜间皮瘤的现状如何？为了提升恶性胸膜间皮瘤患者的治疗，既往在规划性治疗方面都做过哪些尝试？
Good morning, Dr. Pass, and I will just talk using in Chinese, but as you already mentioned, the treatment progress. So the second question actually, in terms of China situation, we will discuss about mesothelioma treatment in China right now. So 我想这个艾医生问我的问题是中国治疗这个胸膜间皮瘤的现状。实际上我们首先讲的是我们在过去的那么多年的话，我们做了哪些尝试的话，第一个我们首先要这个诊断，因为刚才Dr. Pass 实际上谈到了这个治疗上呢很困难的进步，但更主要的在早期阶段，除了治疗以外，我们在诊断上面还是有些误诊，因为在最初很多跟肺腺癌容易相混淆， 所以我们在规范化尝试当中，第一个我们做了一些诊断方面的规范，所以我们现在诊断已经是能够跟国际上面一样，用一些免疫组化的标志物来确诊。那么治疗的现状，就像 Dr. Pass 说的，我们在2004-05年的时候 ，Pemetrexed 也就是培美曲塞，当初在中国是以一个全球的临床试验，但中国没有做临床试验，就是已经批了这个药物来治疗中国的一线的胸膜间皮瘤。那么就像 Dr. Pass 讲的，我们实际上后面也尝试过用 Avastin 来做一些治疗，但是我们看到并没有很显著的这个进步。那么在治疗当中呢，我们对这个胸膜间皮瘤，大家知道实际上是有2个亚型，一个是上皮型，一个是非上皮型。那么这个我们以前称为肉瘤型。总的来说，那个肉瘤型的预后是非常的差。所以整个治疗当初只有是 Pemetrexed 加carboplatin 或者 Pemetrexed 加 cisplatin 是 standard of care， 所以我们整个只有这样用这个来治疗。但是在这些病人进展以后，我们也没有很好的办法。我们试了 gemcitabine， 试了 vinorelbine 这些2线的治疗，我们看到有一点点效果，但是效果不好，所以它的这个长期生存的效果不太好，这是第一点。第二点，我们对胸膜间皮瘤的综合的治疗，特别是手术和放疗，中国这方面早年也做过一些尝试，但总体来说，我们外科手术的治疗效果也不太好，很多病人实际上是没有手术机会的。所以这个是我们在过去在这次这个免疫治疗问世以前，中国目前治疗的这个现状。
Thanks, Professor Shunlu. I will explain some answers to Professor Paul Bass. So Professor Shunlu have already discussed some challenges we are facing in clinical practice. The first is the diagnosis of pleural mesothelioma. So we have to differentiate with lung adenocarcinomas. So we do many immunohistological examination in a tumor biopsy. This is the first step we have made in the progress of diagnosis. And in the treatment, we have the same situation with the West. We still use the cisplatin combined with Pemetrexed as the first-line standard treatment of malignant mesothelioma, and we still lack of many effective second-line or third-line treatment about the disease. So the overall survival, long-term survival of this disease is still poor in China. I think we are facing the familiar status with you in the treatment of this disease. So Professor Shunlu have told, I think this is the main point of the Professor Shunlu's answer. Do you understand me, Professor Paul Bass?
The way you translate it, it's very clear. Also in Europe, we have made only a very limited improvement. I think that patient care and also better diagnosis has led to a somewhat better median overall survival in this disease. And for second line, it is completely correct. There is no standard yet. There have been many drugs tested, but it's still something that we have to focus on.
Thanks, Professor Paul Bass. So we go to the third question, because we all know you have presented the promising results of CheckMate 347 in a presidential symposium at the 2020 WCLC. So we are very interested in the clinical practice or in the clinical use of this combination therapy. So could you please introduce some highlights, share the key highlights from these results, and how do you evaluate the safety of Nivolumab combined with low-dose Ipilimumab?
Yeah, thank you. So this is the first time that a completely new treatment regimen of two IO drugs, immuno-oncology drugs, have been compared to the standard chemotherapy. And at first, with the combination of Nivolumab and Ipilimumab, we were a little bit afraid that it might have toxicity. So in my institution, we first had a sort of phase 2, one-arm study, and we looked at this combination of 3 milligrams of Nivolumab every 2 weeks and 1 milligram of ipilimumab every 6 weeks. And the toxicity was very acceptable. Of course, you have patients who are sensitive for IO treatment, but we did not have any fatalities, and we had some grade 3, 4 toxicity. Then this study came, and I think it's very clear that in all the patients with mesothelioma, irrespectively of their subtype, you have a benefit. And it is a benefit that if you look at the 2-year survival, at the point of 2 years, you have 41% in the immuno-oncology arm versus 27% in the chemotherapy arm. So that is certainly a great achievement. And we do not yet know of this study how the tail of the curve will be after 5 years. It could well be that there are still a number of patients alive. So this is something that immuno-oncology drugs can provide to the community. Now, one of the other interesting things was that for the subtype of the sarcomatoid, or the non-epithelioid type, we must say, chemotherapy has always had a bad reputation, not very good median overall survival. And especially in this subtype, there was a great improvement in overall survival of 10 months. And this is the first time we see something like that. In the epithelioid type, the gain was just over 2 months, 2.5 months. And we had not calculated in the beginning of made a study that we could really compare it. So this is subgroup analysis, and you must always be careful. But it's very clear that for the non-epithelioid, you must have access to this combination. That's very clear.
Okay, so we have noticed the subtype analysis of the epithelioid subtype. Yeah, we agree with you. So we go to the fourth question. The fourth question is for Professor 顺路。陆教授，这个问题我们主要是想问问您，您是如何看待双免联合治疗在恶性胸膜间皮瘤当中的一个价值？那特别CheckMate 743的临床试验，目前它的它所随访的时间是22个月。那么从您的临床经验的角度，您对这样的一个双免联合治疗恶性胸膜间皮瘤它的一个长期获益、生存的获益，您是有一个怎么样的一个预期？
我想这个 CheckMate 743的这个研究呢，是这个15年来在胸膜间皮瘤当中的一个，也是最好的，也是一个唯一的一个真正的3期临床的进步。那么我们用一个比较低剂量的Ipilimumab加上一个标准剂量Nivolumab，它的病人的这个毒性安全性非常好，因为我们用这种模式在肺癌当中，我们也看到在这个 CheckMate 227当中，甚至于在 CheckMate 9LA 当中，我们都用过这种低剂量的Ipi加上 Nivo 的这种联合，所以病人的耐受性非常好。因为从肺癌的2个研究当中，我们看到实际上它3到4的毒性比免疫加化疗都要低，所以总体来说它的安全性是非常的好。那么而且我们会看到，正像刚才Professor Pass 所讲的，我们看到在这个非上皮这种亚型当中啊，这个以前的预后非常的不好，化疗阶段大概只有7到8个月的这种生存，现在基本上延长1倍还多，延长了10个月到18点几个月。我们看到免疫的这种双免的疗法，在恶性胸膜间皮瘤当中2个亚型基本上差不多18.1对18.7，所以这一点已经非常证明，我同意刚才Dr. 巴斯所说的，这个对于非上皮这种类型的这个胸膜间皮瘤来讲，743的这种联合的模式，显著的延长了患者的生存。那么当然刚才也提到2年生存率的已经达到了41%。那么当然现在最短的生存在22%，所以我们可以想象它，因为免疫治疗它有一个脱尾的效应，它在后面的话，这根曲线就走得会比较平。所以我对它的这个3年的这个生存还是非常值得这个预期或者期待的。我个人感觉我们可能至少也能达到像 CheckMate 227在肺癌当中的这种情况，大概在3年生存率能够有在30%几的这种3年生存率。那么这意味着对这个恶性胸膜间皮瘤来讲， 它的总生存差不多基本上可以有3倍左右的这种2到3倍的这种延长，我觉得这是一个可以预期的。
Okay, Professor Povas, Professor Shunlu is agree with your answer. So, from his point of view, he think the nivolumab with combined with low dose ipilimumab, the tolerance is good. It's tolerable in our clinical trial, which has presented in CheckMate 227 and clinical trial GLA. So from his point of view, he think the combination immunotherapy, the safety of the combination immunotherapy is tolerable in clinical practice. And he also agree with you from the subtype analysis we have obtained from CheckMate 743 that the non-epithelial subtype may be benefit more from the combination immunotherapy. So he also expect the long-term survival from this combination treatment. He think the combination immunotherapy maybe contribute 2 to 3-fold of the long-term survival compared with chemotherapy. So he totally agree with you in this question. So thanks, Professor Shunlu. Next we go to the 5th question. The 5th question is for Professor Povas. So as this is the first and only phase 3 trial in which first-line immunotherapy treatment improves survival in patients with malignant pleural mesothelioma. So what positive changes do you think dual immunotherapy will bring to malignant pleural mesothelioma treatment?
Thank you. It's always difficult to look into the future, but I think that this positive study is so convincing that we probably have a new standard of care here, as been discussed before by Professor Shunlu and myself. Is for the non-epithelioid, there's no question about it. Chemotherapy is not a standard anymore. This should be this combination. For the epithelioid type, there might be some discussion, but if you look at the survival curves, you see that there is still a benefit of the IO combination, and patients are very happy to undergo a treatment with IO drugs instead of chemotherapy. I must say the chemotherapy which we use and also is used in China, pemetrexed and the platinum compound, is also very reasonable, tolerable, but this gives you an additional possibility to give as a treatment, so you can delay the chemotherapy. So this is one way of looking at it, and the second one is the possibility, what we will see in the near future, is that chemotherapy will have a top up with IO, but combining nivolumab and ipilimumab, pemetrexed and carboplatin, that might be a challenge. So we will have some other studies with, for instance, durvalumab added to the standard chemotherapy. This is the DREAMER study, which so some other studies have as phase 2 being reported. So we will keep on trying to improve even these promising figures we now have.
Okay, thanks, Professor Povas. And we are looking forward for the launch of this combination, IO combination therapy in China, so we can use this treatment to the malignant mesothelioma. Yes, we are looking forward. So we came to the last question, and the last question is for both of you. So the last question is, since dual immunotherapy is a breakthrough in the treatment of malignant pleural mesothelioma of more than a decade, so what are your expectations for the development of treatment of malignant pleural malignancy in mesothelioma in the future? I think you have mentioned before, so what's your expectations? Please, Paul Bass.
Yeah, well, we are still facing the problem that not everybody who we give immunotherapy has a reaction. And of course, it has some toxicity. So I think that in the near future, much attention will be given to finding out who is the person who is going to respond to the treatment. Because, as I said in the previous question, adding up everything, chemo and IO, also increases more the toxicity. So we also, BMS is going to look a bit in the data we have collected. How can we find patients who are the best candidates for this treatment? Because I think that it is very nice what we have, but we still have not solved the problem. And it's so important that we do not spend time and, of course, money. It's not a cheap treatment on patients who are not going to have any benefit from it.
Okay, thank you, Probus. 那么最后一个问题，因为是两位教授都向两位教授请教。那么陆教授主要是想请问您，因为目前双免可能是最近10数年来恶性胸膜间皮瘤治疗领域的一个突破性的创新。那么您对恶性胸膜间皮瘤治疗的一个未来的发展方向，从您的角度看，您有什么样的一个期待和预期？
我想刚才Professor Boss 已经讲到，就是说第一个，双免已经建立了一种新的标准的治疗。那么未来就是要把这个双免的治疗是不是能够跟现有的化疗相整合，比如说类似于在肺癌当中 CheckMate 9AOA 的这种模式。那么这也是可能是会进一步的延长患者的生存。第二个，我也同意刚才Professor Boss 讲的，我们需要一个 biomark 来预测哪些病人更容易或者是哪些病人真正从免疫治疗当中来获益的。第三点，我想除了刚才讲到2点以外，我们也要讲到，因为有一部分胸膜间皮瘤是采取手术为主的综合治疗，那我们也希望这个双免的疗法未来是不是在辅助治疗当中，在 mesothelioma 的辅助治疗当中，它会占有一席之地。那么这些都需要我们来进行临床试验来确定。如果是在辅助治疗当中，我们还面临着我们用多长的时间，怎么样的给药方式，那么包括有一部分的双免的治疗，因为免疫治疗的总的毒性还是可以的。那么未来是不是和其他的治疗手段，除了手术跟化疗以外，包括部分的放疗的这种整合，都是我们未来在胸膜间皮瘤当中值得探索的。但不管怎么样，我认为基于 CheckMate 713的这个研究，我们已经建立了一个新的治疗的模式。那么相信随着这个全世界在欧盟、在美国或者未来在中国的获批，这个治疗的模式将会使更多的恶性胸膜间皮瘤的患者来获得真正的获益。
Professor Probus, Professor Shunlu has presented his personal perspective, and the first point is agree with you. He thinks the CheckMate 743 has established the standard of care of the first-line treatment in patients of non-resectable of malignant pleural mesothelioma. But yes, he agrees with you. So we should conduct further clinical trial about the addition of chemotherapy into the IO combination, like the short course chemotherapy, like the clinical trial design of GOLA. So he agreed with the addition of chemotherapy combined with the IO combination. And he also agree with you, we should do more research of the biomarker that can predict which patients may benefit from the IO combination therapy. And also Professor Shunlu has his personal perspective from the surgical and radiotherapy view. He suggests we should conduct some clinical trial in the neoadjuvant setting of some patients that maybe benefit from the surgery or benefit from radiotherapy. So he thinks we may cooperate with some clinical trial in this subgroup patients of malignant mesothelioma. That's the opinion of Professor Shunlu.
I fully agree with Professor Shunlu that there's more, and even the patients who have let's say, early stage of the mesothelioma and are candidates for a surgical resection, well, we also know that this is a highly selected group and the survival can be a little bit better, but maybe the IO treatment would be very active there. So we have to see. There is not so much, to my knowledge, ongoing in this field, but maybe Professor Shunlu has study ideas, and maybe we could collaborate in the future to do something like that.
Yeah, thank you. I fully, agree with you that we need to the more study in early setting, especially like the adjuvant for mesothelioma. Actually, this kind of the subgroup patient can be cured, potentially, or at least potential cured, so get the long-term survival. Thank you.
We have finished our 6 questions, so it's time to say goodbye. Thanks, Professor Povas, and also thanks, Professor Shunlu. It's time to say goodbye. See you later.
Thank you.
Thank you.
Thank you.
Bye-bye.
Stay safe.